Hello and welcome. My name is Dr. Karen May and I am the owner and doctor at Momentum Health Centers. Today on Empower Hour, we are going to talk about post-herpetic neuralgia. What does that mean in layman's terms? You got the shingles and now you have lots of nerve pain. So I've had quite a few questions, and we're coming into a season where shingles seems to be more prominent in different individuals. I've heard it in multiple patients and even friends. And I wanted to talk about it to make certain that people have a good understanding of what's going on in relation to the nerve pain that can happen. So we understand that I always give great information, and I think it's useless without an action step. We will give you plenty of action steps that you can help to boost your immune system because it is a virus. And so if we boost our immune system, we can help our body fight off the infection so it doesn't show up, or at least reduce the viral load because we have a good immune system. But this one is I need to make certain is this can affect people in a very painful way. And I want you to have good conversations with your medical doctor. So I want to make certain that you understand that there's lots of information out there, and I want you to make an educated decision for you as to what you should do to either prevent shingles or treat shingles. So please use this as a bit of educational information so you can make an educated decision for your body. So let's back up and let's talk about, we're going to talk about the post-herpetic neuralgia. And if you've had shingles or are familiar with someone who's had shingles, they follow a nerve pattern. So it usually around like the chest, or what they call the thorax, abdomen. We've seen it in legs. We've seen it in the face. They can come into the face as well. I've actually, many years ago, had a patient who had it in her eye. It's devastating. It's painful. It hurts. You can have some open sores and blisters. And some people will have the side effect of the post-herpetic neuralgia. Post means it's after you've had the shingles, you're left with this nerve pain. So I want to make certain that you understand that shingles can be prevented. And this is one of the reasons to talk to your doctors, because I know in the elderly population, they will recommend a shingles vaccine. I am not here to tell you to get the vaccine or not get the vaccine, but understand that if you do get the vaccine, I need you to do something very specifically. You have a responsibility to know, one, what are the side effects in case you're having them, but two, what else could happen within the body. And there's one that's really big, so there's a reason why I want you to know this. I will post the research article in here, but the vaccine is live. So what does it mean? It's attenuated. It means when they put it into you, it's actually a live virus trying to get your body to develop some immunity to it. But in the package insert. So this is not the fact sheet that they hand you. This is the physical vaccine package insert. It has lots of big words on it, but the package insert warns newly vaccinated individuals to avoid contact for an unspecified amount of time with newborn infants, immunosuppressed individuals, pregnant women who have not had the chickenpox or have not been immunized for the chickenpox. Why? Because this research article shows that for 2 weeks post-vaccine, the live attenuated virus is in your saliva. So that means spitting, sneezing, things like that. You could be transmitting the virus, and it can be infectious. So not just that it's not dead, it's that you could cause somebody to have this virus. Also, they were looking at the inoculation site. So where they put the vaccine in and the saliva, they showed that there was the DNA of this virus up to 4 weeks after the immunization. So if you're going to do it, you just have to be aware of the people that you're around and making certain that you're not putting somebody else at risk. So now let's say you had the chickenpox or you got the vaccine, you did fine. Great. Well, now why? What happens with the chickenpox that we can get shingles later on in life? Well, this lays dormant. Literally, the virus, your body fights it. We shouldn't get the chickenpox again based upon the history of what we know with this virus, but it lays dormant. And it literally will lay in and around the nerves, the brain, the spinal cord, around the peripheral nerves. And so what happens is it has to get reactivated. Somehow something reactivates it. And we'll talk about a few of those causes here in a minute. And when that happens, it means the shingles is an infection of the nerve in the area of the skin around it. So usually it's the nerves of that chest and the abdomen on one side of the body. So it's not going to be both sides wrapping around. But like I said, we can see it in the face, we've seen it in the legs and the groin, and like I said, I had a patient with the eye. So as I'm reading from this, it said, the nerve damage that is caused by shingles disrupts the proper functioning of the nerve. So the nerve becomes faulty and confused, and it sends random signals, pain signals to the brain, and it can be chaotic. And so this leads to the throbbing, burning pain along the nerve. Now, not everyone gets it. And some people will have it when you have you're actually in an active infection, but then other people don't have it afterwards, and some do. So what happens is some of the experts agree that shingles it causes some scar tissue that forms next to the nerves, and it creates some pressure. And this is what causes the inaccurate signals, and many of them pain signals, to get up to the brain. So, and it's really, they don't have a good, concise information as to why some people get it and some people don't. So further down in there, what they're looking at is age. Over the age of 65 is something that they notice it's more prominent. Immunocompromised. So if you've had cancer or you're going through active chemo and radiation, if you have autoimmune disorders, you're immunocompromised on many levels. If you have HIV or AIDS, you're immunocompromised. But it could also just be, as we age, our immune system depletes some. So age is part of it. Comorbidities, if you have a lot of inflammation in your body causing heart disease, diabetes, any of the cardiovascular, metabolic syndromes, all of those increase your chances of having shingles. But also, female is another one. If you're female, you already have a little bit of an uptick over guys. Stress, they saw some increase of when you're in a stressful situation. What happens is your immune system tanks, so then increases your risk. But physical trauma as well. So slips and falls, car accidents, there's lots of reasons for physical trauma. What's really interesting that I saw was that if you're African American, you seem to be a bit more protected from expressing the shingles virus, but you still want to make certain your immune system is up as well. So what do you do if you have it? So you got this post-herpetic, well, one is, you'll say you have the shingles, and so your immune system's compromised. It means your body's breaking down faster than it's repairing, and your body hasn't been able to fight the virus. Great, what do you do? So we got to build the immune system, and so we utilize food as medicine and aim for red and orange and green foods. So we're looking for all of these different nutrients. Instead of just taking a supplement, we're looking at all these nutrients such as carotenoids and lycopene and lutein and zeaxanthin and provitamin A foods within your food. They're just super important on improving your immune system. So orange foods, carrots and pumpkins and apricots, and red foods such as watermelons and red pepper and grapefruits and cherries, and green foods, the kales and parsleys, the spinaches, lettuces, some melons that are green. Anything, if you'll notice, 2 times as many vegetables as fruit, but vegetables. And some fruits, they're loaded with nutrients that package and work together. And so it's not like one food is just vitamin A. There's so much in there. And one food is not just zinc, like pumpkin seeds. There's also so much other good nutrients in there. So eating whole foods is one of the best ways you can boost your immune system. The other thing that you can look at is, if you're in an infection, is talk to your physician about utilizing vitamin C and vitamin E and zinc and selenium. Those are good immune boosting properties. I've created other videos for Empower Hour talking about about zinc and vitamin C and talking about vitamin D. So please, if you want more details on that, go to those because there's very specific recommendations. But understand that when you boost your immune system, it's not just for viruses, right? And not just for not specifically just for the shingles virus. It's your whole body. And it's boosting your immune system overall. So some of the research out there for COVID is they're seeing people who have severe symptoms of COVID when they get the infection are very low in vitamin D. So when you're looking at that, blood tests are a great way to do it besides just taking a bunch of supplements. So go back and watch my video on vitamin D so you know exactly where you're supposed to be in your blood levels. So that way you know how to dose appropriately. So making certain that selenium in particular, that one is simple to get into your body through Brazil nuts. And that's also helps with thyroid issues and with an autoimmune disorder called Hashimoto's. So Brazil nuts. 2 or 3 Brazil nuts a day provide enough of the selenium to boost your immune system. So keeping it simple and eating the food helps our digestion, which is where our immune system starts, and you're giving your body the ability to heal and repair. So use food as medicine. Now, my last piece on that one is you have probably watched some of those videos, my food as medicine videos. Get your pen and paper out if you haven't and go through and start taking notes. But then you can go back and fine tune it with some of the videos that I've done on the vitamins and minerals and how to get it and what specific foods that you can get. But please understand that most people think they're doing really good. And when we have people who are coming in to our office and they've been doing good on our program for neuropathy, and then all of a sudden their pain levels go up, we always go back to food. So if you want to know how good you're doing, are you really only getting that 1 cup of crap in a day? Write it down. Write down what you're eating so you can see. Most people tell me, oh, I'm 80-20. You're not. Most people are about 50-50 or 60-40. If you're going through this viral infection or having the post-herpetic neuralgia, you have to be much more dialed in on it. And that's not always easy. But you have to decide, do you like your foods that are crap or do you like your pain? So make certain that you're putting some time and effort. But it's not a magic wand. It takes a little time. So with that, there's a couple topicals that anecdotal that some people have said that it helps. One is capsaicin, applying it on there to your active nerve pain for shingles. Why is because it helps to reduce what's called substance P, and that's something our body makes that increases the pain. So that one, some people may find relief with that. Another one I saw was neem oil, Neem. I've not actually utilized it, but I saw enough people who have utilized it that it may be possible too. I don't usually recommend brands, because I haven't used it, but just a straight up neem oil might be something from there too. So those are maybe some topical things that you can use. If you are a graduate of our program, you should be really working at dialing back into your nutrition and improving your microcirculation through food. But you also have access to your own devices, the Anodyne and the Rebuilder. They are used for pain and swelling and improving circulation and rebuilding and repairing and educating those nerves. So you have tools that you can use. Go back to your initial protocol, what was suggested during the coaching phase. You also have access to our training videos on the private YouTube channel, so of how to use it in your hands and feet, even in your face. So don't hesitate to go and look through those too. Keep it simple. Cold compresses also seem to help. But talk with your doctor. If you are in an active shingles infections, there's stuff that they can recommend as well. And if you know me or if you've heard me talk, I'll tell you I am not opposed to anything as long as it can give you relief and not be harmful to your body. So it's great to have a conversation with your doctor as to what they can do in addition to you boosting your immune system, decreasing inflammation through your food, and improving that microcirculation to work to heal and repair those nerves. So keep it simple. Know that if you have it, most people usually get a shingles infection at some point in life, and that you have the tools that you can work through it in addition to what your doctor offers. Thank you so much, and have a great rest of your day.